verse 8. Sorry, I almost said 7. Definitely week 8. This week is really going to be the week where we start to combine labs and chapters. Things are going to start to become the same chapters. We're going to start kind of reliving some of the things that we've already learned about. So this week what we're going to focus on is really going to be chapters 4 and chapter 6. Okay. So again, we've learned these, we've gone through them, but we're going to touch base on some of the information again. So chapter 4 was dealing with blood collection, and chapter 6 is dealing with chemistry. Okay. So chapter 4, remember, we learned this back in week 4, and we touched a little bit about it when we talked about capillary punctures. But that's really what I'm going to focus on for this part of the chapter, is the capillary puncture, because this week what we'll be doing is doing a capillary puncture with a microcollection tube. So you'll get to play with the smaller vials of, smaller vials for blood collection. Remember that a capillary puncture is considered a skin puncture, and that's how we would retrieve blood. The composition of capillary blood is really more like arterial blood as opposed to venous blood, just because of the fact that your capillaries draw blood from your arterioles, which then come from arteries. Remember that capillary punctures are very useful when you only need a small amount of blood, when the patient has any burns, skin irritations, or very small fragile veins. Patients who have cancer or geriatrics or the obese are generally what we'll use a skin puncture for, just because then we don't have to have so many, it doesn't cause any problems for us to get blood, because instead of trying to find a vein, we just use their fingers. And then we use it for children and anyone who could have a risk with any blood draws. Okay. Remember that though there are some tests that cannot be done via capillary puncture, especially coagulation studies, because we need such a large amount of blood to mix with the anticoagulant, it just does not work to do a capillary puncture. That one will always generally have to be a venous puncture. Blood cultures are the same way, we just need too much blood to try to do that via a finger stick. And anytime you do an ESR, erythro sedimentation rate. So the reason that we don't draw these tests via the capillary method is because, again, we just need too much blood, and it can't be obtained via the skin puncture. So let's talk about POCT, so point of care testing. This is kind of something that we've been doing every week. Just those little finger sticks and all those little labs that we've been doing are all considered point of care testing. But it refers to testing that expands beyond the lab. Okay, so hospital bedsides, at home, nursing homes, and any other direct contact with a patient. So sometimes in a physician's office you won't have a fully functioning lab, but you can do like point of care testing in the office so we can get results quickly. So when you talk about point of care testing, there's two methods. There's that capillary method, and then there is also you can use glass or plastic tube. More frequently than not, you're going to see plastic because that is more safe for patients and for medical assistants than the glasses. Blood will move freely from the capillary tubes and microcollection. There's going to be like a little, like a capillary tube that you've been playing with for the last few weeks, where it will suck the blood up for you, as opposed to having to draw the blood out with the vein. Red marked tubes contain heparin. So if you remember back to when we did hematocrits, we used red labeled tubes. Those were heparin tubes, which really just keeps your blood from clotting. And then your blue marked tubes contain no anticoagulant. So they're kind of essentially like the red top tubes that you use during a venar puncture. So when we talk about microcollection or microtenor tubes, these are generally, they hold more blood than capillary tubes, which is what you'll get to play with this week. Some have a lip on them that actually allows the drop of blood to flow into the tube, which is very nice because it will just drip into the tube. And those lips are color-coded, just color coordinated, just like your Vacutainers are. So you'll see things that are, lavenders, greens, yellows. Those are all the same what you're used to, and they correspond to the anticoagulant or that could be present or absent. Tube should be held at a 30 to 45 degree angle to allow the blood to just run into the tube and into the lip, as opposed to trying to scoop it up. You shouldn't really scoop or scrape that lip across your finger, because then what happens is you pick up your dead tissue cells, and that actually tampers with your result and gives you a bad sample. Now, every week since week 4, you guys have heard me tell you the order of draw, so one more time I'm going to say it for you. But I'm going to say it a little bit differently. Your capillary method is always going to be different than your venipuncture method. So, because of that reason, we want to try to prevent the transfer of substances from one tube to another and allow clotting to take place. So the first tube that you'll always draw is going to be a lavender top tube for a capillary puncture. Okay? This is to keep any microclots from forming. Next, you'll draw anything with anticoagulants or additives, such as green top tubes or 2 blue top tubes. Okay, we do 2 because we label them as label 1 and label 2, and then we'll do gray. The last colored tube that you should always draw would be a red top tube, and that's because at this point blood's probably going to clot if clots are not already forming, and the red top tube is the one that we can do that in. Okay. All right, so let's talk about Chapter 6. So Chapter 6, what it's really going to be dealing with and what we're going to look at is the chemistry section. But this week we are dealing with doing hemocults and collecting stool samples. So because colon cancer is one of the leading causes of death in the United States, we need to know how to perform those 2 tests to help our patients and to help our providers. So if colon cancer or stomach cancer is caught early and is localized, it can be very curable, which is always good to know when we need to, if patients ever ask, we can always help refer that and answer that question for them. The American Cancer Society recommends that a fecal occult blood test or a hemoccult be part of a routine physical exam, generally starting around the age of 40. But if you have a family history of any sort of GI disorders or colon cancer, they probably will start doing it a little bit earlier. It's a very simple, inexpensive test to detect any blood that may be hidden or not visible with the naked eye. Okay? It's going to help look for things such as hemorrhoids or polyps, diverticulitis. It's going to look for fistulas or fistures and colitis. Okay? This test can be done right in the office, or it can even be sent home with a patient. If it's sent home with a patient, what you're going to do is you're going to give the patient 3 test cards, okay? And what you want to do is you want to inform them that they need to really eat a high-fiber diet, okay? They need to eat things that have well-cooked fish or poultry. They need to eat lots of fruits and vegetables. They need to eat bran cereals. They need to have raw lettuce, raw carrots, raw celery. Those are all very high in fiber. And they need to kind of watch what they eat with like peanuts and popcorns, because those nuts can cause some problems with us. But you also want to inform patients what foods not to eat, because if you don't tell them what not to eat, they're going to eat whatever they want. So they should really avoid any sort of like red meats or partially cooked red meats. They want to avoid turnips, cauliflower, broccoli, parsnips, no alcohol, no vitamin C, no aspirin. And the reason for that is because those often give us like false positives, and it can actually make blood appear in the stool when it's really not there. Okay? You want to also explain to the patient that when they go to collect their samples, they have to be from different parts of the stool. Reason being is because if we did them right next to each other, you're really not getting a differentiate in the stool. Generally, we want one from one end of the stool, one at the other end of the stool. And then they'll actually mail those back in once all 3 cards are completed. Alright guys, so that's really kind of a brief overview of everything I've got for you this week. Nothing too crazy for you. Remember, I said I would bring in feces, DEEK species, so you don't really have to go in a cup and bring it in or bring it in a baggie. I've got it all taken care of for you. All you have to do is show up on Thursday for me, okay? Again, just so you guys remember, because I know you're really good about it, but I'm going to tell you anyway, your diversity project, that final draft, and the final draft of your resume are due next week. Next week. So please be sure that you're looking forward for that. This week you have one discussion post. Make sure you get that done by Wednesday. You guys are normally really good about that. And your 2 responses on Saturday. All right, ladies, have a wonderful week, and I will see you guys on Thursday. Bye now.